This is the Dave Pamah Show, a global breakdown of how public systems actually work under pressure and why the same failures show up in different places around the world. I'm Dave Pamah, a retired firefighter, and this is where lived experience meets system reality. You know, when people think about the NHS, they usually think about patients. Now, the NHS is in the UK is the hospitals and healthcare system, which is kind of like it's a free service, you could say, part of the welfare state, unlike America, where it's almost like a marketplace. So it's called the National Health Service, and from here on we'll call it the NHS. But as I say, they usually think about patients, waiting lists, ambulance, A&E departments, operations, appointments. But today, I want to talk about something that most people never think about even. The people looking after everyone else. Because here's the question. What happens when the people responsible for caring for millions of patients don't feel safe themselves? What happens when the nurse who's looking after your family member has spent the previous hour being racially abused? What happens when the paramedic arriving at the emergency knows there's a real chance they'll be assaulted before they even walk through the door? What happens when a junior staff are frightened to report sexual harassment because they don't believe anything will change? These aren't isolated stories. They're patterns. And this week, the NHS has announced something it has never done before. For the first time in its history, NHS employers are going to be formally measured on how they treat their own staff. Not just financially, not just operationally, but on issues like racism, violence, sexual safety, leadership, wellbeing, flexible working. Those results will form part of how the NHS organisations are judged. Now, some people will hear that and think, surely that should already have existed. Exactly. And that's why this matters. Because today isn't really about racism or violence or harassment. Today's episode is about accountability. And accountability changes systems. One thing I've learned over many years working in emergency services is this. Every organisation measures something. The question is, what do they choose to measure? Because whatever gets measured gets managed. If you only measure waiting times, managers will focus on waiting time. If you only measure budgets, managers will focus on budgets. If you only measure targets, guess what? People chase targets. But if nobody measures how staff are actually treated, guess what happens? It quietly slips down the priority list. Not because individuals, managers are bad people, but because systems naturally move towards whatever they're judged on. That's human behaviour. That's organisational behaviour. That's true whether you're talking about hospitals, fire services, police, schools, or businesses. Now, I can only speak from my own experience. As a firefighter, we dealt with violence, we dealt with abuse, we dealt with traumatic incidents, we dealt with members of the public who were frightened, drunk, aggressive, sometimes mentally unwell, sometimes simply taking their anger out on whoever happened to be standing in front of them. People often imagine emergency services are somehow protected from society. They're not. Emergency workers experience society as its absolute extremes. When people are having their worst day of their lives, that's usually when we arrive. Most interactions are respectful, but the difficult ones leave a lasting impression. And the cumulative effects matters. One bad incident doesn't usually break someone. Hundreds over years, that's different. Here's something the public often don't see. Violence isn't always physical. Sometimes it's verbal abuse. Sometimes it's intimidation. Sometimes racism. Sometimes repeated sexual comments. Sometimes bullying inside organisations themselves. Sometimes discrimination that slowly wears people down over years. Sometimes it's never one major event. It's hundreds of small moments, tiny cuts, over and over and over again. Eventually, people stop speaking up. Not because they don't care, because they don't believe anything will happen. That's one of the biggest warning signs inside any organisations. When reporting falls, that doesn't necessarily mean problems have disappeared. Sometimes it means people have lost faith. So the NHS isn't just introducing guidance. Guidance already exists. Policies already exist. Training already exists. Most organisations have excellent policies. Policies are easy. Culture is difficult. The real change here is accountability. Hospitals will now know that how staff experience the workplace becomes part of how they're assessed. That changes conversations inside boardrooms because now senior leaders have to ask different questions. Are incidents being reported? How quickly are concerns investigated? Do staff trust leaderships? Do minority staff feel protected? Are violent incidents actually reducing? How effective are line managers? These become performance questions, not optional discussions. That's a significant shift. Now, leadership isn't just making speeches. Leadership is creating conditions where people feel psychologically safe, conditions where concerns can be raised, conditions where fairness isn't just written on posters, it's experienced. You can just usually tell whether an organisation has healthy leadership without reading a single strategy document. Just ask frontline staff one question. If something serious happened tomorrow, do you believe management would support you? That answer tells you almost everything. Let's think about the individual. Imagine being a newly qualified nurse. You've worked for years to get there. You're enthusiastic. You want to help people. Then over time, you experience abuse, perhaps racism, maybe bullying, maybe inappropriate behaviour, maybe violence. Nothing changes. Even you start asking yourself, is this really worth it? Now, multiply that by thousands of people. That's how organisations lose experienced staff. Not overnight, gradually, quietly, one resignation at a time. This is where everything connects. People sometimes think well-being is separate from patient care. It isn't. They're connected. If staff are exhausted, patients feel it. If teams don't trust leadership, patients eventually feel it. If experienced workers leave, patients feel it. If sickness absence rises, patients feel it. Every system is interconnected. There's no saying in emergency services, if you can't pour from an empty cup, or you can't pour from an empty cup. That's what I meant to say. Well, healthcare is no different. Now, let's zoom out, because this isn't just happening in Britain, it's across the world. Healthcare systems are facing similar pressures. Growing populations, older populations, staff shortages, burnout, violence against healthcare workers, recruitment problems, retention problems. Different countries, same pressures. Different political systems, same workforce challenges. Whether you're looking at Europe, North America, Australia, parts of Asia, healthcare workers are increasingly talking about the same issues. Feeling unsupported, feeling exhausted, feeling unsafe. That tells us something important. This isn't simply a national problem. It's a systems problem. There's another issue here. Society has changed. Many public-facing workers report increasing abuse. Not just NHS staff, but drivers, teachers, police officers, firefighters, retail workers, social workers, customer service staff. Many occupations now describe behaviour that would once have been considered completely unacceptable. That should concern all of us. Because when abuse becomes normalised, the quality of public services eventually declines. Not because staff stop caring, because people eventually leave. Culture is one of those words that's often overused. But what does it actually mean? Well, culture is simply what happens when nobody's watching. Do people intervene? Do managers listen? Do colleagues support one another? Can junior staff challenge senior staff safely? Does reporting lead to action? You don't build cultures with slogans. You build it through repeated behaviour every single day. Some people won't like public league tables, but others will welcome them. But here's what league tables do. They create visibility. Once something becomes visible, questions start being asked. Boards ask questions. Inspectors ask questions. Staff ask questions. Patients ask questions. The public asks questions. Visibility creates pressure. Pressure sometimes creates improvement. If only organisations generally engage with it, not if they simply chase another target, that's the challenge. There's something organisations have to avoid. Turning this into another tick box exercise. We've seen that happen before. Good intentions, lots of paperwork, little culture change. Real improvement doesn't happen because forms are completed. It happens because leaders consistently model behaviour. Because staff believe actions will follow. Because trust develops over time. Trust can't be manufactured. It has to be earned. Even if you've never worked in healthcare, these lessons apply everywhere. Businesses, universities, emergency services, charities, government departments, private companies. People stay where they feel respected. People leave where they don't. It's really that simple. Money matters. Working conditions matters. Leadership matters. Feeling safe matters. Feeling valued matters. And when organisations ignore those basics, eventually the performance problem appears somewhere else. Usually in recruitment, retention, sickness, productivity, or on public confidence. And most headlines will focus on racism, violence, sexual safety. Those issues deserve attention. But beneath those headlines, the deeper story is this. The NHS is recognising something fundamental. How you treat your workforce isn't separate from service performance. It is service performance, because organisations don't deliver care, people do. Buildings don't comfort patients, people do. Policies don't save lives, people do. Technology helps, funding helps, processes helps, but ultimately it's still people. And if the people inside the systems aren't supported, eventually the whole systems feel the strain. So one of the biggest mistakes society makes is believing public services run on buildings. They don't. They run on trust. Trust between colleagues, trust between staff and leaders, trust between the public and frontline workers. Trust that if something goes wrong, someone will listen, someone will act, someone will care. The announcement this week won't solve every problem. No single policy ever does. But introducing accountability changes incentives. And incentives change behaviour. And it shapes behaviour as well. Whether that translates into genuine cultural change, only time will tell. But recognising that staff experience matters just as much as operational performance, that's an important shift. Because healthy organisations really happen by accident. They happen because somebody decided people matter. Not just outcomes, not just targets, people. And perhaps that's the biggest lesson of all. Every public system eventually reflects how it treats the people inside. Not how it describes itself, not what's written in policy, but what staff actually experience every single day. And that's true whether you're talking about the NHS or any public service, anywhere in the world. Because whether it's here in the UK or anywhere else in the world, these systems don't fail in all isolation. They fail in patterns. And once you understand patterns, or understand the pattern, you start to see it everywhere. This is the Dave Pamah Show.